But for now, JoyNews investigations have uncovered breast cancer patients at the radiotherapy unit of Ghana's two main referral hospitals are made to pay some unapproved fees before being administered a life-saving drug. An agreement signed between the government of Ghana and the Swiss-based pharmaceutical company Roche in 2018 provided breast cancer patients with treatment drug called Herceptin, now at no cost, but the radiotherapy units of the two hospitals are billing the patients for facility user development fund and chemotherapy fees before they are administered the drug. Investigative journalist Kritinati reports the hospitals are making up to 300 cedis per vial of Herceptin administered to the patients.
Today when I'm here, they are telling me that to pay 250. That's why I'm surprised.
Vida, not her real name, is a middle-aged woman battling breast cancer. Her biggest worry now is she spent all her savings battling the disease. Now her business is on the verge of collapse.
All my money is finished. So yesterday when I came, they told me that the money is covered for insurance. So I'm glad that my money is working for me today. They told me that to pay the 250.
It's Vida's fifth time at the radiotherapy unit of the Kolebu Teaching Hospital. She's being asked to pay 250 Ghana cedis before she's given medication. Even though she's covered under the National Health Insurance Scheme, she will not be administered the Herceptin injection until she pays the money. She's issued with an invoice containing facility user fees and chemo. The Global Cancer Incidence, Mortality and Prevalence, Globocan, estimates that 16,000 cases of cancer occur annually in Ghana. In 2018, the Ministry of Health and the Swiss-based Roche Pharmaceuticals signed an agreement aimed at making Herceptin free for breast cancer patients under the National Health Insurance Scheme. Country Director of Roche, Philip Addison, said the partnership between government and the Swiss company was to eliminate the cost barriers faced by breast cancer patients in Ghana.
What we had given the government was supposed to be completely reimbursed by the NHIS, so that patients would not have to pay, so that money would not be a barrier for any woman or any patient who would need Herceptin for breast cancer.
But JoyNews checks reveal since November last year, health officials at the radiotherapy unit of the Kolebu Teaching Hospital have charged patients 3 different unapproved fees before administering the Herceptin injection. In one encounter, 2 patients were charged separate amounts, 250 Ghana cedis and 200 Ghana cedis. On the 14th of November last year, before assessing breast cancer medication, these monies were meant for facility user fees and chemotherapy, though none of the patients was offered chemotherapy. One of the patients we have decided to call Veronica said she sought explanation from the authorities at the radiotherapy unit of Kolebu on why she was charged for a treatment which was meant to be free. She was told the money was meant for consultation. She says,
there is another one looking at your condition. There's an injection they give you, and for that one, it's NHIS covers it, but they still let you pay some amount to cover parts.
If NHIS covers it, then it suggests that you don't have to pay anything. Have you asked them why they are making you pay when it's supposed to be free?
When you ask them, they tell you the radiotherapy unit is not, they don't take NHIS. So for their consultation and other things, you have to pay for it.
I have seen on the receipt that there is a do they conduct chemo on you?
No.
The Chief Executive Officer of the Kolebu Teaching Hospital, Dr. Daniel Asari, says his office isn't aware of these charges and has not sanctioned them. But head of the radiotherapy unit of the hospital, Dr. JoyNews, tells us the patients are not supposed to pay these fees. The discrepancy was caused by delays in relaying the information to the facility not to charge breast cancer patients after government entered the agreement with Roche to absorb the cost related to breast cancer treatment in July last year. We began the investigation into the payment of these unapproved fees in November 2019. It means this delay Dr. Yani talks about has persisted for 5 months while patients were paying monies they weren't supposed to. Next, we traveled to the Ashanti regional capital, Kumasi, to ascertain how the free breast cancer care program was being run there. We met Ajua Kunedu, not a real name. She's one of the breast cancer patients assessing care at the Komfanochi Teaching Hospital. She was charged 60 Ghana cedis for breast cancer treatment.
And I must say, I'm warm and then a bomb misrim. And a nurse in a boarding pa, and this are buying a boa. I must have any day in Jiska. In Jiska, now what you mean, Sabia, Namako. Now what you mean,
the Obia and Jews sky a fapani and home.
That's what they be. And not tell me, could you food that me chat and city. Me chat and city. Na me ko pan and so me chia 20 cedi. And answer na 3 weeks in the best be 3 days time answer na 3 weeks na so na mako lab. And me chia 30 cedi. Na me de ko. Ti me de ko chia doctor we answer na ya wo me pan no so.
Ajua Kunadu was also not supposed to be charged these fees under the existing agreement. A report on the implementation of the project to include the Herceptin injection on the medicine list of the National Health Insurance Scheme added the injectable at a reimbursable cost of 3,914 Ghana cedis to radiotherapy units of Kolebu and Kath. Sources at the National Health Insurance Authority tell us these units of the hospitals make 300 Ghana cedis in excess profit per vial of the Herceptin injection they administer to breast cancer patients. Head of the oncology department of Kath, Dr. Osebonsu, disclosed the monies charged to breast cancer patients would go into the unit's development fund. Clinical oncologist at Kath, Dr. Francis Margaret Williams, sheds more light on the rationale behind the fees charged breast cancer patients.
Every time a patient comes in to see a doctor, as in for a consultation, we have what we call a ward fund. The ward fund is meant to manage the place. As in, you come, you want to use the washroom. After using the washroom, you need soap to wash your hands, some tissue, leave a light bulb.
And so that's our latest investigative piece by Kwitinati. Now, we're joined via WebEx by Dr. Joel Yani. He's Director, National Center for Radiotherapy, Oncology and Nuclear Medicine at the Kolebu Teaching Hospital. Thank you very much, sir, for your time here on Newsdeck. Doc, you said that Kolebu has stopped charging the facility user and chemo fees. Hello, Dr. Yani. Dr. Yani, can you hear me, sir? All right, so we'll try and correct that the sound challenge there, so we can have Dr. Yani speak to us on this the story that we just brought to you, our latest investigative piece by Kwetenate, and that is we have uncovered that the breast cancer patients at the radiotherapy units of Ghana's 2 main referral hospitals are made to pay some unapproved fees before being administered a life-saving drug. An agreement between the government of Ghana and a Swiss-based pharmaceutical company, Roche, in 2018 provided breast cancer patients with a treatment drug called Herceptin at no cost. But the radiotherapy unit of the 2 hospitals are billing the patients for facility user development fund, that's when you go to Konfuanoche, and also chemotherapy fees before they can receive the essential drug. And Kwetenate brought you details there. We understand the hospitals make up to 300 cedis per vial of Herceptin administered to the patient. The Kolebu Teaching Hospital has an intervention, and Dr. Yanni will be joining us again via WebEx to give us that clarification. This morning after we aired the story, we got word from them that they would want to clarify some bits of information put out there. And we will be joined by Dr. Yanni, who is head of the unit. Dr. Yanni, thank you very much once again for joining us here on Newsdesk.
Right.
Great. It's good to have you now. So we understand that you have an intervention on the story that we put out this morning.
Yes, I do.
Can you go ahead, sir?
Right. Herceptin was introduced in the country, let's say about 7 years ago, but it has been used for a long time worldwide. Okay. And it is free in some jurisdictions.
Okay.
Including some.
We advocated for it to be free here as well. And through the advocacy and with cooperation from Roche Pharmaceuticals, we set out the modalities for it to be given for free. And indeed, it is free. The cost per vial is 6,800, and you require 17 doses. So for the full course, it takes about a year. It's about 100,000. And now it's given to patients for free. So I was a bit taken aback with your documentary.
So we have not said that you're selling the drug Herceptin to patients. That is not our story. Our story is that you are charging them fees, unapproved fees, which makes it almost impossible for them to be administered with the drug. And I'm talking about, in your case, which is Kolebu Teaching Hospital, we are looking at the facility user fee and also chemotherapy fee. And so that is the story we put out there.
Right. Chemotherapy is not for free. Indeed, the Herceptin, the form which was used for about 7 years was IV4. Patients, the nurse who is administering has to wear a coverall, mask. It comes in IV fluids. There are other costs attached to it. And the Herceptin is also not given alone. It is given with other drugs, which may not be free. So even though the drug itself is free, there are service charges.
Our understanding with the documents that we have from Roche, the agreement, it says that you make up to 300 cedis on every vial you administer, and that is also confirmed by the National Health Insurance. And those monies are supposed to take care of the other expenses that come with the administration of the drug. And so why are you charging anything at all?
Yes, exactly, that's what happens. The service fee. Service fee to cover the things that we have to use to give the drug.
Yes, but patients are not supposed to bear the cost of that per the agreement.
So it should be borne by who?
By government. The NHIS, government, through the NHIS.
Up to now, that is not happening. So the service...
And so Dr. Yanni, you are not denying that you are charging these amounts. Your reason is that government is not giving you the monies as expected.
My reason is that it's service fee.
It is service fee, but you're not supposed to be charging.
So who covers the cost of the coverall?
So government is supposed to do that, and I suppose that you're supposed to go through your administration, through the NHIS, to make sure that the monies are paid. Have you done that?
We do not receive any money for that. It's service fee, and that is what is charged for it.
You are saying that you are not receiving monies. I just wanted to get it clear. Are you aware that you are not supposed to be charging in the first place?
And we are not charging for the drugs.
We are not saying that you're charging for the drugs. What we are saying is that the other costs that come with the administration of the drug is supposed to be taken care of by government through the NHIS. You're supposed to be making 300 cedis more from administering the drug, and that is supposed to take care of these facility fees, chemotherapy, and all of that. That is the agreement.
It is not exactly so.
So what is the situation there?
When acceptance is given, what you are saying is partly true. Like when the acceptance is given with another drug.
Which other drug is this?
It's called paclitaxel.
Okay.
And the paclitaxel may or may not be on the health insurance. The supply is a bit erratic. Sometimes it's on, sometimes it's not on. So the situation is not as simple as that.
And how much do you charge per that?
Hello?
How much do you charge for this extra medicine that you administer alongside with Herceptin?
I don't know exactly, but it is billed by people involved.
You do not know how much you charge for that?
Pardon?
You do not know how much you charge for that?
I don't know exactly how much. It's around that.
But are you charging facility user fee? Are you charging for chemotherapy as well?
Yes, we charge for facility user fee.
How much do you charge for facility user fee?
It varies. It depends on what the patients use. You need gloves. You need a coverall. You need a face mask. You need IV fluid. So depending upon what you use, it is covered.
Can you give us a range?
It may range from about, let's say, 150 to about 250.
150 to?
About
250.
Yeah.
Okay. So that is the point we are making, that just last week we spoke to a patient who was charged up to 50 cedis for chemotherapy. There was another one before that who was charged 250, okay, for facility user and also for chemotherapy. The point we're making is that you're not supposed to be charging for these because you make up to 300 cedis when you administer the vial to these breast cancer patients, and that is supposed to be taken care of.
Taken care of by who?
I've made the point already, by government, sir.
We are supposed to we are running a service, and we need this accoutrement. At the time of service delivery, we need to give IV. At the time of service delivery, a cannula is used. At the time of service delivery, if at the time the drug is not available, it has to be bought, not the effect, the other one. So now, there are costs involved that has to be covered.
Now, the NHIS boss says the fees you are charging are unapproved, and this is Dr. Selby. How do you react to that?
He hasn't proven that it's unapproved.
She hasn't proven that it's unapproved?
No.
You are doubting the NHIS boss?
Yes.
Very well, sir. I want to thank you for your time here on Newsdesk. That is Dr. Yani. He heads the radiotherapy and oncology unit of the Kolebu Teaching Hospital. He hasn't denied that they're charging some extra fees from administering Herceptin to breast cancer patients, except that he's saying that these fees, these monies which are supposed to be taken care of government, are not being provided or released as expected. I will be bringing you more on this story by Kwete Nate in our subsequent bulletins. Now, away from that, a 25-year-old man whose whipping of his 3-year-old son leading to severe injuries has been convicted of crime. Now, Ebenezer Osei-Bonsu today changed his plea to guilty and pleaded for leniency. Sentencing has been deferred to the 9th of this month. Now, his 3-year-old son was hospitalized with severe wounds after he whipped him with a belt and power cable for bedwetting. Widespread public outcry greeted the disturbing pictures of the boy's ordeal, which went viral on social media. He finally pleaded guilty to a charge of assault and causing harm. Love FM's Erastus Donko has more.
Junior's body depicted a prisoner of war tortured in a concentration camp when he was rescued from his father by his mother and the Bokrom police. Deep cuts and marks of assault spread over his back, hands and thigh, with 2 huge bumps on the forehead. Junior's 26-year-old mother could not hold back her tears when she narrated what happened.
I'm sad because of my son. How is he suffering? He can't sleep. I want him to be in jail. Yes, I don't want him to come home.
Ebenezer Osei-Bonsu pleaded not guilty when he first appeared before Kumasi Circuit Court. He was granted bail but could not meet the bail conditions. The prosecution was on the verge of moving the case to a higher court after the presiding judge rejected the accused police caution statement and that of the victim and his mother.
The young man who shipped his child with a belt and cable wire until the child developed huge wounds on the back, thighs, and legs has finally been convicted of the crime. Today, in court, he changed his plea from not guilty to guilty. Ebenezer Osei-Bonsu, who was looking very sober in court today, decided to change his plea. According to his lawyer, they cannot argue with the court. He committed the act, he beat his child, just as has been reported, and that they are calling or praying the court to give the accused person a mitigated sentence.
My client, having slept over the matter for some time, decided to change his plea. And he is in the dock. I'm only to advise him. So we weighed the implications or the ramifications of the plea, the change in plea. Of course, the Attorney General were also included. So we came to the realization that fine, if it is going to help our cause, why don't we give it a try? I believe it is as a result of the remorse. All along, he has been remorseful. He intimated to me that he was not guilty. He pleaded not guilty. But within him, believing that he had actually beaten his son, it was within him. So it was like he was living a double life. In court, you are not guilty, but in private, you are guilty. Then why don't you open up to the court, for the court to deal leniently with you, for you to be free, both within and without, so that you'll be able to bite the bullet and then submit yourself to the jurisdiction of the court and whatever the court is going to say.
Reporting for JoyNews, Erastus Asaredonko, Kumasi.
Last thing, Kumasi, 2 siblings who recovered from COVID-19 they contracted in the line of duty as frontliners have launched a campaign against stigmatization. Dorcas and Elizabeth also say their decision is informed by widespread discrimination against recovered patients. The duo, a psychologist and a nursing officer at the Konfanochi Teaching Hospital, say their decision is informed by the widespread discrimination against recovered patients. My colleague Ohiminte of our health desk caught up with these two and filed the following report.
Many patients who have recovered from COVID-19 continue to suffer stigmatization from the public in Ghana. Some are even virtually ostracized and banished from their communities and place of work. Dorcas, a psychologist and nursing officer, Elizabeth, are among about 20 health workers who tested positive for coronavirus at Kath.
The first time I was told Me, I took it normal. I was okay. Yeah, I wasn't scared. What came into mind was that, okay, people have gone through it and have survived. Though lots of people have been dying globally, but many of them have been through it successfully. So that one didn't really make me scared.
It all started, I went to work one Sunday afternoon, and after work I came home, started feeling some headaches. It was getting severe in the night. So I did malaria test and it came out negative. But the next day it was still there and I wasn't taking it easy. So I started checking my temperature. That Tuesday morning I checked, it was 37.5. And in the morning I went there. They did the test and they called me the next day and told me that it was positive. I just took it out, I was fine.
Ghana Health Service says stigmatization of COVID-19 patients remains a challenge. Dorcas, an expectant mother, and her sister are encouraged by their scary situation to fight for all victims who are being despised by society. They have, in one way or the other, had a fair share of the negative attitude, even from colleagues at work.
I heard a whole lot of news about those gossiping, stigmatizing and all that. Those who were stigmatizing, I learned some of them even tested positive also. Some were thinking, hey, where did she get this condition from? Others were saying a whole lot of things about me. Hey, is it because she's like this or that? Because we haven't gotten any case. We've not seen any patients with this kind of condition, so how come? But they did also think that you can come in contact with a patient without any symptoms and you can contract it. So I think that's how it happened, but they didn't understand. Most of them even thought that I brought the condition to the directorate.
Dorcas and Elizabeth are aware of the challenge ahead of them, but they are determined to make a positive impact. With support from relatives, they are reaching out to as many Ghanaians as possible to change the mindset about coronavirus.
I was also thinking of how my colleagues at the workplace will take it. But later I said I will still join. I think it will help.
I want to tell the society that if someone has it, you don't need to stigmatize the person. COVID-19 is not a death sentence. Being positive for COVID-19 is not a death sentence. You can go through it successfully, as I have gone through it. So there's no cause for alarm. I know there are good people in Ghana who will be interested in this campaign, and they will come on board to help in funding this project to make it a success.
From Kumasi, Ohimi Interior reporting. And on our Stop the Stigma campaign today, we hear from the chairperson of the National Commission for Civic Education, Josephine Nkrumah, about the dangers of stigmatization. And you can join the campaign with the hashtag Stop the Stigma. Still to come here on News, the Sports Ministry uncertain about the return and future of sporting activities in the country, despite the easing of some restrictions of COVID-19 pandemic. And that's from the Sports Minister, Isaac Isiama. The Sector Minister announced a number of measures today. Gary Al Smith joins us via Zoom with some thoughts on this. Hello, Gary. Thanks for joining us. Let me start with football. There was no clear direction on what the game would be like going forward. Surprised about that?
Yes, we were, because the Ghana Football Association president was seated right at the press conference. And when the question was thrown by our colleague Muftau Nabila, we expected it to be deferred, as the sports, the information minister usually does when he's on the podium, to the person in charge of whatever sector is being talked about. But the sports minister in this case just gave us a blanket assurance that he believed that the people at the GFA were capable enough to handle the situation and to give us a roadmap. Unfortunately, he didn't give Ketu Kraku the opportunity to answer directly for us to know. The background, of course, is that the Ghana Football Association themselves have penciled the 30th of June as the dates for which they would have given us an update on when football will resume, subject, of course, to the national policy on the ban on social gatherings. Now that restrictions have been eased, we do know that football was exempt from the 14 disciplines that have been allowed to start training. And this will end on the 31st of July. So meaning that once the GFA had penciled the 30th of June and the president of Ghana has penciled the 31st of July for that extension, we needed to know what the GFA boss will say. Unfortunately, he wasn't given the opportunity to answer today.
And Gary, I want us to quickly listen to Mr. Siama again, just to recap a few of the things he said, and then we can come back to this conversation.
Happy to announce that Ghana's preparation to host and organize the 2023 African Games is on course. So far, there hasn't been any indication of the postponement of the Games. Nonetheless, the 2023 African Games project team, led by my hard-working Deputy Minister, Perioku Jato, are officially preparing for the events come 2023. As you are aware, sports continue to contribute to a wide range of social benefits, such as improvement in health, crime reduction, and the promotion of social and national integration. Sports also help individuals in tension management and the inculcation of desirable values such as honesty, perseverance, courage, and respect for law and order. In addition, the core values inherent in sports are compatible with the principles necessary for development and for the maintenance of peace, such as fair play, cooperation, respect for opponents, teamwork, and acceptance of rules. The life skills earned through sports help empower individuals and enhance psychological well-being, such as self-esteem. In order to avail ourselves of the enormous benefits in sports, His Excellency the President of the Republic, Nana Addo Dankwa Akufo-Addo, on 31st May 2020, per his update number 10 of Phase 1 on easing restrictions, announced that individual and contact sports can go ahead with the appropriate social distancing and hygiene protocols. To begin with, what do we mean by individual non-contact sports? By definition, non-contact sports are those where participants should have no possible means of touching. In view of the nature of the COVID-19 pandemic, team sports generally do not qualify for exemption because of non-adherence to physical distancing. Accordingly, and in line with the presidential directive, restrictions on the following individual and non-contact Olympic sport activities are lifted with immediate effect. Athletics, generally, badminton, baseball and softball, chess, cricket, cycling, golf, gym, individual non-contact para sports, Keep-Fit clubs, of course, in attendance should be 100, not exceeding 100. So pay any attendance for a Keep-Fit club, don't exceed the number 100.
Gary, on that very last note about the figure 100, does it work for you?
For the figure of 100, you mean?
Yes.
Well, the president did give that directive, so I suppose the sector minister could only take the feed from the president. And so whether it works for me or not, I mean, it's a national policy that we all have to adhere to. But I mean, if you look at the various sporting federations, if you look at the practicality, if that is what I think you are asking, I think it's workable because, I mean, we've asked churches to go 100 at a time for 1 hour, and I suppose that the various sporting disciplines should be able to do the same as well. Don't forget that, I mean, for sporting activities, some are competitive, but a lot of sporting activities are also for recreational purposes and also for personal exercising and so on, which brings me to things like tennis, table tennis, going to the gym and so on. I doubt many gyms in this country will be having 100 people at a time, even in normal times. You get my point. So I suppose the answer to that is yes, it is workable, and yes, it does make sense, I think.
Now, let's talk about the stimulus package. So Mukhtar asked that very important question, why football clubs were not, considered in the package, because they also run a business. We are told that something will be coming through the sports authority instead to take care of them. Do you know anything about this? Are you hearing of anything in the corridors of the youth authority?
I think this is where the large part of, we have Ministry of Youth and Sports, but people are always accusing, even us journalists, of focusing only on the sporting aspects for many a year. So this is where the YEA, we are told, is going to be relevant again, because according to the sector minister, the YEA has some money and or a roadmap, if you like, to take care of athletes, not the federations. So the various athletes in the various federations are going to be taken care of under the YEA's policy or whatever it is that they are going to have. And if there's any money to be given from there, they will let us know. But so far, no, we have not had any concrete announcement as to how that will work.
No, but then for me that is a problem. It is good to take care of the athletes, that is fine, but the clubs themselves are businesses, and from what I understand, some are still paying salaries for their players and the athletes. So some help would have to come through for them.
Yes, that is problematic, and of course you can imagine that a lot of the clubs will start, hitting hard at the government a bit because they have been exempted from that. Because 2 weeks ago on Beyond the Lockdown with Mbefapel, you heard the GFA president, the sports minister, also say that the Ghana Football Association directly employs about 4,000 people or 5,000 people, and indirectly the numbers are too many to count. Indeed, Kojo Adai-Mensah, who is the CEO of Data Bank and an avid sports follower and a sports enthusiast and a sports pundit, has said that he reckons that the football industry alone, not even sports, the football industry alone contributes about 5 to 10% of Ghana's GDP. That's what he says. And so if you take all these arguments and these figures, it suggests that probably, if we have data to back it up, then maybe the government should take a second look at making sure that the various sporting federations and football clubs will also be taken care of. But I suppose that is a discussion that will continue. It's important to note also, Ernest, that we are not here in a vacuum. 2 or 3 weeks ago, the questions started popping up about how football and other sporting disciplines were going to be catered to. Now, Kojo Nkrumah told us that, for example, the Ghana Golf Association had put a proposal forward, and they were told to go through the sports ministry to present a bumper proposal for all sports, to make an argument to be part of the sports ministry. From what we are hearing now, we can only surmise that the sports ministry or the various sporting federations, unfortunately, were unable to convince the government that the sporting sector needed to be part of the small and medium scale enterprises who got the 600 million first and then the 400 million first, which made 1 billion. So that is where we are. Clearly, the sports sector was unable to convince the government about their usefulness, quote unquote, or why they need that amount. So probably they'll still have to argue better and present their case more forcefully.
Absolutely, and let's see how all of this pans out. There's a lot more to this that we can chew on, but I'm sure Joy Sports will be bringing us all the interviews and the analysis in our subsequent programs. Thank you very much, Gary, for joining us. Now, away from sports, let's talk about elections. This is your election headquarters. The executive director of the Institute for Democratic Governance, Dr. Emmanuel Akwete, is worried that the Electoral Commission is not communicating enough to the voting public just a few weeks to the new voter registration exercise. Now, speaking on the AM show, Dr. Akwete insisted the EC at this opportune time needs to encourage its top officers to be the ones communicating relevant information to the public to engender confidence in the impending registration exercise and create the credibility for the program.
So if you compare what is happening now to 2016 to 2012, I think a lot more communication is required. Also, anytime EC communicates, it educates. Okay, it explains what it's going to do, where it will get to, and what kind of support it needs from people, the assurances it gives, and so on. So that communication is important. Secondly, you would find out that communication is not only left to communication officer. Okay, usually the EC chair plays a very important role, Afarijan. Okay, will step in to also be pedagogic, of course, the team about how things are going, and various other persons, not only the bureaucrats, but also the commission members who do that. So I think at this stage, the process is starting, which is very good, but they need to be quite active in explaining things at every stage. Okay, and also letting people know ahead of time.
Dr. Akweti also encouraged the Electoral Commission to increase the period for its pilot registration to enable it to adequately detect the anomalies that face such new registration exercises.
I think in the past the EC had more time than now, which is not entirely its fault. COVID is COVID. And so it's now going to have to operate within very strict, limited time. And that calls for greater cooperation. Otherwise, these processes will be delayed. So you're talking about 2 days. I do not think 2 days pilot test in Accra is enough. You have to go to the other regions. Maybe the newly created regions are maybe sparsely, populated. They are new and people are still moving or whatever. So you may not have to deal with huge crowds. Okay. The 6 put together is just some small percentage of the people that need to be registered.
This is News Desk with me, Ernest Mino. Coming up in business, government takes steps to improve ICT access with plans to construct 30 facilities across the country. Daryl has details after this break. Don't go away.
Good morning, welcome to Business. My name is Darrell Kwao. The Minister for Communications, Esther Owusu-Ekufo, has cut short for work to begin for ICT facilities in 30 communities across the country. The project, expected to be completed within 6 months, has been inspired by a survey conducted by the ministry, which revealed that many communities have no access to basic electronic platforms provided by government for education. There's more in this report.
The 8 million cedi project, to be funded by the Ghana Investment for Electronic Communication (GIFEC), will also serve as a business resource center for rural areas. Speaking to Joy Business after the sword-cutting ceremony in Eswom, one of the beneficiary communities in the eastern region, Communication Minister Esther Owusu-Ekufo explains that the outbreak of COVID-19 has made it necessary for such a facility.
It's not just the students who need IT skills in this current age. If the pandemic has taught us anything, it is that ICT is indispensable for every aspect of our lives. We're learning remotely, doing telemedicine, working remotely, having our meetings on various IT platforms. And so this community also needs to be engaged, and all communities in Ghana also have to be part of the information age. There are some which have access to the internet, but for which the internet is not affordable. And this is one of such communities. In the ICT center, they can all access it for free, apart from those who will use those facilities to facilitate their business will be required to pay a small fee, and even private businesses as well, so that we can use it for operations and maintenance.
Among the communities to benefit include Dodowa, Winneba, Pram, Atonsu, and many others. The minister also disclosed how the project will be rolled out.
Spending about 8 million cedis to build these 30 ICTs and centers. And it may seem expensive, but when we did our assessment, it comes in way cheaper than some that have been built previously. And we're excited about the prospects of it. because they can become e-services centers in the various communities.
Administrator for the Ghana Investment for Electronic Communications, Kofi Asante, urged beneficiary communities to ensure that the facilities to be provided are put to good use.
Farmers are making a case for Ghana to create local demand for the industrial use of the commodity so as not to overly rely on international markets as COVID-19 pandemic affects purchases. Charles Aite has more.
You have the fermentation box in this way. This is our own fermentation box we've designed, but we copied this technique from the cocoa research. So when they do it, it goes through a three-phase process. The first one you see here is where you put the fresh cocoa pods that have been broken into. 2 days after that, we bring all of them into the second box. We do this so that we would be able to get an even fermentation, because if they are all grouped at one place, the top gets more, the under gets more fermented, but the top doesn't get anything better. So once you do it and you turn it after 2 days, then the top gets to the bottom and the bottom gets to the top. So once you do that, after another 2 days, which is the fourth day, you move it from this second box and turn it back into the third box. So what you are seeing here is gone through the second box, and then we are ready to take it into the third box today, this morning.
Sure. I start with Samuel Tetekobo, who gave reasons why cocoa farming could be the best option for graduates.
Ghana has a lot of human capital. We can say out of this youth, about 60 or 70% are idling. But this is where we can create the environment, conducive environment for people to go into agric, and in particular cocoa farming.
And that's it for business. There's more after this break.